might want to spend a few minutes talking about the questions that we're sharing with our safety net health plans and what they should be thinking about in health reform. So I think first and foremost, providers throughout the country are trying to do a little math, right? So they're trying to think, first, how many uninsured do I have? How much is Medicaid going to expand? So in Illinois, it's roughly 800,000. Second, they're thinking, is my state going to expand Medicaid early? Probably not at this point, but I'll take a nod to my state colleagues in terms of whether the resources are available to do that. They're also thinking, how many people are going to gain coverage via the exchange? There's about 1 million Illinois residents who are estimated to do so. And again, these are figures that were developed by the federal government. So you all from the state, if you have more nuanced estimates, I defer to you. Importantly for the safety net providers, because we're looking at the exchanges providing subsidized coverage for those under 400% of poverty, if you look at those patients served by the safety net, there are going to be a lot of them who are going to be going through the exchanges. So the safety net providers are going to have to be intimately involved with kind of the setup of the exchange and knowledgeable of that exchange, because a lot of their patients are going to be there as well. Big issue that's going to be on the mind of the safety nets is how do you facilitate enrollment. And certainly there are a host of individuals in Illinois who are eligible but not currently enrolled in coverage. But right now the safety net does provide an enormous service in terms of enrolling people for coverage. And that role is just going to get more intense over the coming time. A lot of people in DC, it was a little frustrating to hear them talk about the role of the safety net post-health reform. And they said, well, we're not going to really need a safety net because everyone's going to have coverage. And it always just, mystified me. Like, really? That's interesting. We're going to expect community hospitals throughout the country who do not have an expertise in caring for specialized populations, who don't provide translation services, transportation services, mental health services, social work services. I'm getting out of breath. I could go on and on. To really just pick up those patients. And do we really think that they're actually going to be clamoring for those patients, given that the only Medicaid rates that we increased in health reform were primary care rates, and for a short period of time? So there is still a really significant role for the safety net. In fact, in Massachusetts, we did see an increase, on average, low-income patients increased. In a study we did of the two major safety net providers in Massachusetts, Cambridge Health Alliance and Boston Medical Center.